My name is Dr. Ejike. I'm the Civil Society Focal Point for Nigeria and FP 2020. I also chair the Technical Management Committee of the Association for the Advancement of Family Planning, AFP. In the past years, we've been working collaboratively with the government to advocate for family planning services in the country. We succeeded in successfully advocating for counterpart support of $3 million initially, and later on increased it to $4 million counterpart support. Before now, all the commodities that are imported into this country for use are actually brought in by the development partners and donors. We've also gone ahead to make sure that in the London 2012 summit, that we strongly advocated to government to make a commitment, and the government made a commitment of adding additional $8.3 million for reproductive health commodities. And then in 2018, post-2017, Nigeria also made a recommitment in their commitment to increasing our CPR from what it was to 27% modern methods. But we also have been working collaboratively with the government in terms of accountability-related issues. We developed an accountability scorecard, which we have used to score governments to make sure that they are meeting their commitments, or at least attempting to meet the commitments they made to the FP 2020. We've also worked in that manner with the Federal Ministry of Health to develop the family planning blueprint. And with that also, we developed the state level costed implementation plan, which is the most important component of the document that will be used for family planning services in the country. We've moved on to also track the budgets and make sure that it is being done well. And part of what we are doing, we worked at the sub-national level by engaging about 18 advocacy working groups. And within some of them, we had also state level led accountability mechanisms that work collaboratively, having members of the civil service as their leaders. And that way they have been able to increase family planning money in their respective state budgets. In terms of what have we been able to do in terms of learning, we've learned that collaborative work is key, especially with the faith-based organizations. We successfully advocated to the two faiths through their interfaith forum. We were able to develop a Christian perspective and a Muslim perspective in family planning. And that has gone a long way to be able to be used to educate the clerics the importance of family planning and a well-developed country. These are the things that we have done, and moving into the future, one area that we feel that we have to make sure that happens in terms of post-2020 going to 2030 is to continue to strengthen those collaborations. We will continue to make sure we train more civil society organizations in issues of accountability, budget tracking, and then also get more of the media houses involved in the work that we do. Because with the media, our reach will be more, and they will be able to resonate our information, our messages across the country. These are the things that we're doing and we plan to do. I want to thank you for listening.